ladies and gentlemen, and sibingelela nabantu abasemakhaya, ikakhulukazi sibingelela ama SASSA recipients. You know, I see them these days baloku baya dance bathi qing qing. Ngifuna ukuthi laba abadansayo bathi qing qing. They must understand ukuthi the money that is in here ayona imali yokudlala. Imali esetshenzelwa kakhulu. Imali okufuneka ukuthi yondle abantwana. Imali okufuneka ukuthi ikwazi ukukhulisa abantu nanokuthi abantu bakwazi ukuziphilisa. So I'm saying I see that there's lots of social media playing around with the cards and dancing, king, king. The bottom line is that this card, it holds a financial resource for people to use that money sparingly, number one, for them to use this money for right reasons, for them to use this money that's in the card for the well-being of their families, for the well-being of themselves. But I also do want to say the money that is here is money that has to be taken care of, because this is money of people who pay their taxes to make sure that our social safety net is protected. So laba badensayo bathi qing qing ngizonilandela just to see ukuthi le mali ni spenda kuphi. Thank you very much. Dumelang sanibonani molweni, absheni, and a very good morning to all. I wish to thank you for joining us this morning for this briefing from the comfort of your home and workplaces. But I also wish to thank those at home who are really waiting to hear what is it that we have to offer today. As it has been indicated, I'm accompanied by the two CEOs of SASSA and NDA, and I continue to say the three of us have to work with each other, because as a minister, I need to guide at a political level. They have to guide. SASSA CEO has to make sure that everything goes well and money is paid on time to everybody. But also, most importantly, the National Development Agency is an agency that is supposed to help people stand on their own 2 feet. The purpose of today's briefing is to provide you with updated social development response measures against the spread of COVID-19 pandemic. This update is in the context of level 4 of the lockdown. And ngiyafuna ukusho ukuthi level 4 we lockdown uyazama ukuthi usinikeze ithutshana lokuthi sikwazi ukwenza izinto, but at the same time level 4 uzosibonisa whether sizokwazi ukumuvela to level 3 no level 2 na, and all that depends on us as government, but it also depends on citizens taking responsibility of making sure that they practice the protocols of COVID-19. Let me thank all the women and men on our front line of the fight against this disease. Mangibonge futhi wonke umuntu osebenza ngezidingo zethu. Akufanele sikhohle ukuthi sadalwa ukuthi sikwazi ukuzimela. We truly appreciate your dedication and commitment in carrying out these essential services. But these essential services will almost be meaningless if citizens themselves also do not take responsibility and make sure that they keep the distance, make sure that they wear the mask, make sure that they do the right thing for themselves, individually, collectively as family, but also as communities. Ke rata go leboga motho emong le emong ya latelang melao ya tshwantsho ya lefu lena. Batho bohle ba hlokomela gore lefu lena le gotse naholo. Therefore, we must remain united in our determination to beat and overcome this virus. Overcoming it, we will collectively, as government, as civil society, as NGOs, as NPOs, but as families individually, from house to house, street to street, and community by community. We continue to reiterate the importance of each and every one of us to wash hands regularly, stay at home, go out when only it is absolutely necessary and essential, and observe the appropriate guidance of physical distancing. Last week, I convened one of the regular extended special min-max meeting with all the provincial MECs of social development to coordinate and ramp up our interventions to ensure all vulnerable groups in our community are appropriately supported to access basic necessities to cope with the new normal. I must really appreciate MECs for their continued support throughout this time. We are seeing a much stronger coordination with the provinces. We have agreed that we will upscale our communication through various platforms to ensure that the public is well aware of all the services provided by the Department of Social Development as a portfolio, and the portfolio means SASSA and NDA. I'm truly honored to work with the caliber of MECs whose support is constant and unconditional, and I thank each and every one of them and their teams at provincial level. I also thank the MECs for participating fully in the provincial structures, but also thank the regional managers, both of SASSA and NDA, for being part and parcel of those teams, because it's very clear that if we don't have a coordinated effort in our work, we will never be able to defeat this virus. With regards to regulations on the extension of lapsed disability grants, I want to indicate we are taking proactive measures to protect the livelihoods of the most vulnerable in our society during this period. To this end, we have published the regulations which give effect to the extension of temporary disability grants from the date they were suspended until the end of October this year. I'm aware, and I gave the letter to the CEO. Somebody came right to my gate to say, we have a problem with people with disability, we can't apply, we can't go to SASSA offices. What are we going to do, Minister? And I handed over that letter to the CEO, and I'm sure that the CEO and her team have taken that. And this is part of the reasons also we decided, let us do this. This extension applies to all temporary disability grants that lapsed between February and March. Izicelo zama grant wabantu abakhubazekile zivumelekile ukuthi siqhubeke nazo until uOctober. Labo ke abaziyo ukuthi bebenalo leli thuba lokuthola ama grant wabo, ngicela ukusho kubo ukuthi ama grant wabo azoqhubeka until the end of October. And ngethemba ukuthi by that time futhi nathi siwusasa so bese sizamile ukuvula amanye ama office njengoba ama directives sesiwatholile nje ukuthi kancane kufuneka siphindele emsebenzini. In cases where the temporary disability grants were suspended, they will be reinstated and paid until the end of October. The same applies to the care dependency and foster child care that are due to lapse during the lockdown period. The payment of these reinstated grants will take place before the end of May. We hope this extension will give persons with disability some peace of mind in the midst of this deadly virus. With regard to the amendment of regulations relating to the movement of children, this is one of the biggest challenges we had, where in our original plans, we only looked at people who had documents that were signed off by courts and all that. But we realized that ngesintu, abantu noma behlukene ngesintu, sometimes abayi e-court ukuthi abantwana bakwazi ukuvakashela ogogo nomkhulu. Kuba nesivumelwano nje phakathi kwama-family. And therefore sibona lokho we decided ukuthi asenze kube lula for bona ukuthi abantwana bakwazi ukuphindela kuma parents wabo, so that ama parents akwazi futhi ukusebenza nabo ukubanceda ngesikole, ngoba abaningi manje they are doing their work electronically and otherwise. So sifuna ukuthi sisenzele lokho ukuthi bakwazi ukuthi abantwana baphindele emakhaya. Ngiyacabanga ukuthi nogogo nabo bese bekhathele. Uyazi abantwana bahlupha kanjani mabeloku begijigijima into engapheli. Mase ukhulile nje impela kuba nzima ukubabheka. So silungisile ke leyo nto ukuthi the children must be able to go back to their parents. We have amended the regulations with regard to the movement of children between co-holders of parental responsibilities or caregivers as guided in Section 1(1) of the Children's Act, Act number 38 of 2005. Under the new regulations, the movement of children between co-holders of the parental responsibilities who reside in different metropolitan areas, district, municipalities or provinces is allowed, provided the co-holder of the parent responsible or caregiver has the following: a court order or a parental responsibility and the rights agreement of parenting plan registered with the family advocate, a permit issued by a magistrate which corresponds with the Form 3 of the regulations if the documentation in paragraph A and B is not available. We developed this form on the basis that we realized that some of them would not be able to move if they don't have the top documents. I must hasten to add that before a magistrate issues a permit, I referred to above, he or she must be provided with a birth certificate or certified copy of a birth certificate of the child or children to prove a legitimate relationship between the co-holders of the parental responsibilities and rights, and written reasons why the movement of the child is necessary. Here I do want to indicate that many parents were frustrated and saying, why are we being bureaucratic about this process? We all know that families sometimes have really serious problems, and therefore the movement of children, others come and take the children, and it causes a distress, number one. Number two, we also had to be responsible to make sure that child trafficking and all that doesn't happen, because we must be conscious of the fact that yes, we are suffering now under COVID-19, but some of the social ills that are a problem in our society, they continue, and therefore it's important for us at all times as government to assist citizens also to be responsible in this process. We have specifically made these amendments to allow any child who was not at a residence of the primary caregiver prior to the announcement of the lockdown to return to the primary caregiver. However, I must point out that this will be done in a once-off basis, which has already happened. We appeal to all parents, caregivers who share joint custody to be reasonable, to act in good faith, and to prioritize the health and safety of their children when making decisions about whether children should be moved in the first place. We have a zero tolerance for any parent or caregiver who recklessly exposes a child to any COVID-19 risk. And I want to indicate here that I'm confident that no parent wants to be infected, him or herself, and no parent wants to see that happening to any of the children. And I'm sure that parents will take all the precautionary measures. Amendment of directions of social development facilities and services. This has been a long time coming because many people have been complaining that they have no access to SASSA offices, but we also want to still indicate to our communities and to our people who depend on our services the importance of the health of the SASSA workers and any other worker in government is also very important. I've always been saying to everyone working around me, protect yourself first before you can go protect others, because you will not be able to help others if you are not helping yourself. Ensuring that vulnerable groups remain protected from this pandemic remains our priority. To this end, we have amended a number of regulations relating to the substance abuse treatment centers and halfway houses, child and youth care centers, shelters for victims of crime and gender-based violence, as well as residential facilities for persons with disability. With regards to substance abuse treatment centers and halfway houses, The amended directions make provision for the release of service users from these facilities upon social workers' recommendations. The same applies to the release of victims of gender-based violence and that of children in child and youth care facilities. The amendments also make provisions for the prioritization of all matters relating to children in conflict with the law. With regards to early childhood development ECD centers, the sectors remain close in the alert level of risk 4 adjusted approach. We will continue to monitor the implementation of alert level 4 risk adjusted approach to review this decision in consultation with relevant structures to ensure that whatever a decision is made for this sector to open, it is COVID-19 ready in order to protect children and the staff working in these facilities. I must indicate that these facilities, some of them fall under a National Development Agency and are supported by the National Development Agency, but also we have to work very closely with the Minister of Basic Education. We follow carefully what the Minister of Basic Education is saying, also considering the fact that the issue of hunger is a big problem out there. Most of these children that used to go to the ECD centers, they used to have the 2 meals within the 3 meals. Yeah, they would have the 3 meals, and therefore we understand the pressure on parents when these children are no longer getting this food, especially those that are in the most underprivileged areas. However, I have included in the directives to allow provinces to continue paying subsidies in order to fulfill their administrative responsibilities and payment of stipends. Older persons facilities remain closed during the alert force due to their vulnerability to COVID-19. However, we encourage all facilities to ensure that implementation of COVID-19 protocols and work with district health teams for continuous screening and testing. With regards to inter-country adoption, these services are suspended during the state of national disaster. With regard to recruitment of social workers and professionals, as COVID-19 continues to impact on individuals and families across South Africa, social service professionals are on the front line of our national pandemic response. In this regard, we are recruiting an additional 1,809 social workers to reinforce the current workforce and to provide a range of social work services, including timely psychosocial interventions to support affected individuals and family. This point for us is very important. I think everyone is aware of the fact that we have an estimated figure of how many social workers are needed and necessary for our country, because we believe that if we had as many as social workers as possible, street to street, so that they can be able to understand and appreciate what is happening within the communities, we need thousands of social workers, and we're working towards ensuring that those social workers are employed. And I'm very much aware of the fact that many social workers have been contacting me directly and saying they're unemployed, they are sitting at home, and yet the need for social workers, especially at this time of COVID and post-COVID. So we are looking at what is it that we can do, working with other departments, but also ensuring that maybe Treasury can step up and assist us in this one, because we do need to have as many social workers as possible. The allocation of additional social workers per province is as follows: Eastern Cape 171, Free State 92, Gauteng 676, KwaZulu-Natal 266, Limpopo 116, Mpumalanga 128, Northern Cape 833, Northwest 81, Western Cape 246. The social workers will be employed for a period of 3 months. 3 months for now. Priority will be given to social work graduates who have registered on the department's database of unemployed qualified social work graduates that we developed in 2019. A further 1,210 unemployed social work graduates will be given a 1-year internship opportunity in a joint venture between WH-SETA, the South African Council for Social Service Practitioners, the DSD and VETS Consortium. the SASSA will ensure that all graduates signed up for the 2 projects are verified and licensed to practice. They will also be exposed to training before their placement. The provisions of psychosocial support services are an integral part of disaster response, as it helps individuals and communities to build back their lives. And we think that COVID-19 has also come with huge challenges, especially if you think of the fact that the children are not able to go to school, the parents are also at home, and the parents need to help the children, but also we have that unending scourge which has to end in South Africa, that is of violence against women and children. And at this point in time, I've indicated before that I can imagine the challenges when people can't go out and be able to hustle for themselves and make the money to make sure that they take care of their family. So the stress and strain is there. With regards to the National Development Agency, the National Development Agency has recruited and placed 580 volunteers with CSOs in all 52 districts to support the distribution of food to vulnerable families. In addition, 620 volunteers will be added to increase the number of volunteers by NDA to bring the total to 1,200 volunteers. These volunteers assist the DSD portfolio in addition to food distribution on educating families on COVID-19 preventions, verification of applicants for the special COVID-19 social relief of distress grant, fast-track the purpose of payment of this grant. To date, these volunteers have distributed over 100,000 local language brochures on health and education, and I think that the CEO will further explain to that, especially if there are questions. With regard to food and nutrition program, the department has been providing food and nutrition services to combat the growing challenge of malnutrition and hunger amongst poor and vulnerable communities. The department developed a system of food distribution that has been working since 2013 to 13-14 to provide food. This intervention is informed by Section 27(1) BC of the Constitution, which states that everyone has the right to have access to sufficient food and water. I think at this point, it's important for us to note that President Cyril Ramaphosa, before even COVID-19 happened, was engaging with us as government in general to say, as a nation and as a country, we must not have any citizens going hungry in our country. And it is for that reason that we also, as SASSA and NDA, we are saying, while we are paying social grants and their grant recipients, it's important for them to also look around them and say, what is it that they can do to improve their well-being, because it's possible and it's possible for them to have the gardens, it's possible for them to do a whole lot of things. And now that also we are under lockdown, this is the opportunity when ordinary citizens should be looking at opportunities around them with our help, of course, because this is what we say, this is what I say in particular. We empower our communities in order for them to power themselves. Communities and families have got means of working one way or the other and ensuring that they support each other. But of course, government has to take responsibility, it has to take responsibility to support our people. We have noted the challenges with long queues for food which is distributed by NGOs. These challenges were experienced when the private sector and NPOs in the main distribute food parcel in an uncoordinated manner, wherein the local municipality, provinces and law enforcement agencies are sometimes not informed and not part of this distribution. And we've seen a number of instances where people go to the communities, they don't talk to the leaders of the community, they bring the food. When people are hungry, you will know that they will run out just to catch something. I think we must give dignity to our people. So if you are distributing food, it has to occur to you that those people also need to be treated with dignity. There is no dignity when you come with a van and you make everybody run around and strip away their dignity. I'm making an appeal to all those that are distributing food, while of course appreciating the fact that South Africans in their hundreds stood up to say, what is it that we can do? And we we saw a whole lot of food coming out from many areas. Our concern is an uncoordinated distribution of the food. But more than anything else, it's also about ending up with the food being in some places and the far-flung areas not getting the food. This uncoordinated food distribution creates duplication, partisan and corruption challenges, whilst proper coordination structures and mechanisms at national, provincial and local structures exist, and we acknowledge it might not necessarily be enough. I'd also like to request all those who have received the food parcels to please be considerate and not take more than your share. We are struggling. People are struggling. There is nothing as painful as people who become selfish and self-centered and take food parcels. Some of them end up even selling the food. This is not the time for that. This is the time for us to help each other. I would like also to please understand that our resources are limited. So when you take 2 instead of 1 of food parcels, you are taking away from another vulnerable family. To all those NPOs who are fighting shoulder to shoulder with us to ensure that our people are able to access food, I wish to express our sincere appreciation and gratitude. We are going to develop directives that address this challenge. These directives will encourage NPOs to coordinate with municipalities, provinces and law enforcement agencies to ensure that they distribute food and are better coordinated. Here's the issue. It's one thing for us to keep on writing directives and writing regulations and all that. We're going to end up tangling ourselves with all these. The plea is that people on the ground, the plea is that communities must be able to appreciate what is happening, but the NPOs and NGOs and all others must also be able to appreciate what we are asking them to do. And it will be important for them to follow the directives that we are going to do. In addition, as of 30th April, SASSA has received over 80,000 applications for the social relief of distress. And of these, 57,763 applications were eligible. At this point in time, so that I don't cause technical glitches in my explanation, I would like to ask the SASSA CEO to be the one that runs through, especially in areas that are related to how you're going to apply, what are the qualifications, when are we going to launch all that. I will give, maybe before I give to you, can I ask the CEO of NDA to just quickly deal with the NDA issues? And then we'll go back to SASSA because then we have to finalize with the activities.